My colleague Nantara caught up with Vikram Kirloskar as well as Satish Reddy on the sidelines of CII. Let's take it across to that conversation.
That India as a country, compared to developed countries, has hardly spent anything on this pandemic. But look at the results. We have probably one of the lowest rate of infections now. It's been a continuous slope downwards. The death rate is I think there are more road accidents than COVID deaths in the present situation. I think we've done a fantastic job of, because of discipline of using masks and, with the whole, everything seems to have worked. And that is giving me confidence with the way also the finance minister has talked about the deficit. She's stated the deficit right now, and she's given a gentle slope to close it. And this huge amount of infrastructure spending on as far as the auto sector is concerned, spending on buses, on metro, and of course the scrappage policy, as you said. I think these are great positives along with the no new taxes. I think there is also a perception difference which has come out. I feel there used to be a perception saying that government is anti-private sector. I haven't seen any of that in this budget. It looks very positive. They've talked about privatization of government assets rather than saying disposal or monetizing so much, but as privatization. I think there's a change. There's a confidence in the whole system, in everything, that we can also make our country run ahead.
Absolutely. And Satish Reddy, if I can come to you now, this is a government that is planning to spend more. Look at the ballooning fiscal deficit, but it's something the markets are lapping up as well, because a glide path has also been provided as far as fiscal consolidation goes. From the healthcare perspective, it's a 130% plus rise that is being planned by the Central Exchequer. What did you make of the announcements around healthcare?
Frankly, it was long overdue, Nayantara, because every year at least the private sector has been expecting that the spend on healthcare would go up, because compared to all other major economies, we are one of the lowest spenders. Say, if you take between both the center and the state, the whole expenditure is just about 1.6% or so of the GDP, which is hardly anything. And every year we've been expecting this, so finally it's been announced. That's the positive step. It's also being spent out in terms of which areas it will be allocated to. For example, on infrastructure, healthcare infrastructure, both primary and all the three, primary, tertiary and secondary. And also in terms of establishing public health labs, in terms of biosafety labs, and even the number of labs that would be set up. A whole host of things were actually announced, which is very encouraging on one front. That's number one. Second thing is about vaccinations. They've also talked about 35,000 crores being spent on vaccinations, which I think is very important at this point of time, because this is a country of over 1 billion plus people, and most of them have to get vaccinated. It's just started off now, but with the entry of more and more vaccines coming in from companies, especially from India, you would require that kind of an expenditure and support from the government, which also was announced. And the last one was on innovation and R&D, especially for a sector like ours, in pharmaceuticals. It is very, very timely and encourages us quite a bit, because they've talked about 50,000 crores over 5 years through the National Research Foundation. But importantly, they've said that it is for improving the research ecosystem, which is what we've always been suggesting to the government. It's not just one part of the whole piece, it's the entire ecosystem that needs to be developed. And that intention has been announced, the money has been allocated, so we feel good about it.
But Satish Reddy, I'm going to ask you a question a little differently. Yes, it's a 130% rise. About time. It took a pandemic for India to get serious about spending more on healthcare. But even then, when you look at the allocation, for example, to the vaccine, yes, the finance minister said when it's needed, we will increase it. But did that disappoint you, the allocation that we've seen, about 35,000 crores?
Not at all, because frankly, if you see the expectation, in various quarters, the expectation was just about, say, 25,000 crores or something would be allocated. So in a way, it was good. So, there is no end to an expectation, right? But again, we are trying to be realistic. There are also methods by which even the say the companies can be roped in, because, for example, CII made a recommendation saying that recognize it as part of CSR, right? If you were to vaccinate our employees, and if you see large companies, they would have thousands of employees, and that's a burden which companies would be willing to take to a certain extent. And they also there are various ways by which this vaccination can be done. And in terms of, say, the whole administration part of it, I think it is quite sizable that 35,000 crores was allocated there.